Oh, so I recently had to redo my CRMA and wanted to put together some videos for that. This one is mostly video, so I'm trying something new. So let's move on.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and today I want to demonstrate how to take vital signs. First, what you want to do is you want to gather your supplies. Typically what you're going to need is a stethoscope with a blood pressure cuff, along with a thermometer of some type, a pulse ox, a watch, and some gloves, along with a disinfectant wipe to clean the items that are not disposable. Then what you want to do is you want to perform hand hygiene and don the appropriate PPE if necessary. Like if your patient's in contact precautions, you'll want to put on the correct PPE. Now, what is collected during the vital sign measurement? Well, you'll be checking the patient's blood pressure, heart rate, respirations, and temperature. In addition, you'll be asking the patient their pain rating, which is sometimes referred to as the fifth vital sign, along with collecting their oxygen saturation. So I've arrived to the patient's exam room and I've performed hand hygiene. Now what I want to do is I want to introduce myself to the patient and tell them what we're going to be doing. So hello, my name is Sarah. I'm a nurse here and I want to be taking your vital signs. Is that okay with you?
Yes.
Okay, then you want to do your patient identifiers by looking at their armband, having them tell you their name and their date of birth. Then I like to start with the easiest thing, which is pain. And so I'm going to ask him his pain level. Now this is a very easy and important assessment tool because high pain ratings, if the patient is in pain, it can alter their vital signs. It can increase their heart rate, their blood pressure, and respirations. And it's really important, especially to ask a patient their pain level if they've just had surgery or some type of trauma. So to assess pain levels, you can do that with various scales. Most commonly, we use the 0 to 10 numerical scale. So can you tell me your pain, with 0 being no pain at all to 10 being the worst pain you've ever had? What's your pain rating?
0.
Okay, he says he's having no pain. That's easy. But let's say that he said that his pain rating was an 8. Well, you would want to ask some more questions. You want to say, where's your pain located at? And please, can you describe it for me? Like, is it burning? Is it radiating? Things like that. And then you want to document that, the numerical rating, along with the words that the patient used to describe the pain and its location. Next, we're going to measure the patient's oxygenation status. And to do that, you can use a portable probe like this one, or one that connects to a bedside monitor. And to do that, you're going to place the device on the nail bed because that's where it's going to obtain the reading. So make sure that you pick some fingers that have good circulation. They're nice and warm and pink. So we'll turn on our device and we will place it on the finger and let it get a reading. And here the patient's oxygen saturation is 97%. A normal oxygen saturation is anywhere between 95 to 100%. And below you can also see the heart rate as well, but here in a moment we will actually check the heart rate. And then you'll just want to remove the device, and if it's like a portable one like this, you'll want to clean it with a disinfectant wipe and then document your findings. Now we're going to collect the patient's body temperature. And some things you want to remember about body temperature is that in an adult it can vary. It can be anywhere between 97 to 99 degrees Fahrenheit, with the average being about 98.6 degrees Fahrenheit orally. And in an adult, it's considered a temperature if the temperature is greater than 100.4 degrees Fahrenheit. Now, the temperature reading will depend on the route that you use, and you can take a patient's temperature various ways, like orally, the forehead via the temporal artery, tympanically, which is via the ear, rectally, or axillary via the armpits. And a rule of thumb to remember is that rectal and tympanic temperatures will be 1 degree higher than the oral route, and temperatures that are collected via the axillary or the temporal route will be 1 degree lower than oral temperatures. So we're going to take the patient's temperature using the temporal artery, and we're going to use this device. So what you want to do first is you want to use a probe cover if your device has one. That just protects it from becoming contaminated. And what we're going to do is we're going to hold the probe flush up against the skin at the center of the forehead. We're going to take it and scan it across the forehead to the hairline and look at our reading. And before we do that, you want to make sure that the forehead is clear of any type of hair or anything, because this probe needs to be making contact with the skin. If anything comes into contact with it, it can throw off the reading. So we're going to put it flush against the skin and hold the button in on the device, and you'll hear it beeping, and scan it to the hairline and look at our temperature. Now, if your patient was sweating on the forehead, because a lot of times whenever patients have fevers, they can sweat, you would want to do it the same way. Probe up against the forehead in the middle, hold the button down, scan across the forehead to the hairline, but you're also going to go behind the ear, because sweating will decrease the temperature, and it's very vascular back here behind the ear, and that will just help us obtain a proper reading. Then what you're going to do is you're going to clean your device and document your finding. And if you didn't take it orally, you want to make sure you document the route that you actually took the temperature. Next, we're going to check the patient's pulse. And as we feel the pulse, we're going to be looking at several things. Of course, we're going to be counting the rate, but we're also going to be feeling the strength of the pulse. And we will be grading it on a 0 to 3 plus scale, with 0 being the pulse is absent, 1 plus weak, 2 plus normal, and 3 plus bounding. And the rhythm, is the pulse regular or is it irregular? Now, in adults, the most common site to use to check the pulse is the radial artery, because it's really easy to access. So it's found, what you want to do is find the thumb, and it's found below it in this wrist area along the radial bone, hence why we call it the radial artery. And whenever you're checking the pulse, have the patient, they can sit in bed, they can lie down, and you'll want to support their arm, extend it out and support it. And you're going to use your first 3 fingers to feel the pulse. Don't use your thumb. Your thumb actually has a pulse in it. So use your first 3 fingers and find it within that area I just told you, and lightly just touch it. Don't press too hard, and feel the bounding of the pulse. And what you want to do is you want to count it for 30 seconds if the pulse is regular, and multiply that number by 2. If it's irregular, count it for 1 full minute. So his heart rate is 82, it's regular, and it's 2 plus. And a normal heart rate in an adult is 60 to 100 beats per minute. Now what we're going to do is we're going to keep our fingers here, because what we want to do next is check the patient's respirations. And if you tell a patient that you're checking the respirations, they're going to alter the way that they're breathing. So we're going to stay in this same position and assess respirations. And when we're assessing respirations, we're looking at a couple things. First of all, the rate. A normal breathing rate in an adult is 12 to 20 breaths per minute. We're also looking at the depth. Is it labored or unlabored? And the rhythm. Are the breaths regular or irregular? And I have found the easiest way to do this is really look at the patient from the side and watch their gown, their clothes. Are they rising and falling? Because 1 rise and 1 fall equals 1 respiration. You can also sometimes just gently take your hand, put it on their back, and feel the rise and the fall of the chest. And so you will count that for 30 seconds if their breathing rate is regular, and then multiply that by 2. But if it was irregular, you would need to count for 1 full minute, and then document your findings. And lastly, what we're going to do is we're going to measure the blood pressure. And to do that, we want to make sure a patient is sitting down with their arm at heart level and their legs are uncrossed. Now, if they're lying in bed, you would want to make sure that this arm is at heart level. Then what we're going to do is we are going to get our stethoscope and our blood pressure cuff. And you want to make sure you get the right size cuff for your patient's arm, because if you use too big of a cuff or too small of a cuff, it can throw off the reading. And what we're going to do is we're going to palpate the brachial artery, because this is the artery we're going to be listening to get our blood pressure, because we're going to be getting our systolic number, which is that top number, and this is the first sound we hear, and then our diastolic number, which is the bottom number, and this is the point where we no longer hear the sound. So whenever we're looking at the gauge of our blood pressure cuff, we want to make sure we're really noting those points, because that's going to tell us our systolic and diastolic number. So what we're going to do is we're going to put our cuff on our patient, and we want to make sure we find the brachial artery. This is the artery we palpate that we'll be using to determine our blood pressure. And it's found in the bend of the arm. So we're going to find it and it is located here. And we're going to look on our cuff, and our cuff has these arrows. And because this is the left arm, we're going to make sure that this arrow is pointing in that direction of where that artery is. So you're going to put the cuff up about 2 inches above the bend of the arm. First, what we want to do is we want to estimate the systolic pressure. So we want to find that number. To do that, we're going to palpate the brachial artery, and we're going to inflate the cuff until I no longer feel the brachial artery. And at that point, when I no longer feel it, I need to make sure I'm looking at this gauge to know that number, because that number is our estimated systolic pressure number. Then when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than that estimated number. Now, the whole reason for doing that is because we want to avoid missing the oscillatory gap that can occur in some patients. Not all patients have it, but some. And it's usually patients with hypertension, because the oscillatory gap is like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So I'm inflating the cuff while feeling on the artery, and I'm going to note the point where I no longer feel the artery, which is about at the 100. Then I'm going to deflate it completely and wait about 30 to 60 seconds, and then we'll take the blood pressure. So our estimated systolic number is 100. Now I'm going to inflate the cuff to 130, and that will avoid missing the oscillatory gap if one was present. So I'm going to take my stethoscope, put it in my ears. You can use the bell or the diaphragm of your stethoscope. I like to use the bell because it's best at picking up low-pitched noises. So we're going to place that over the brachial artery. Do it lightly. Don't fully compress it because you can occlude the artery. Then we're going to inflate our cuff to 130 millimeters of mercury. And we're going to let it fall about 2 millimeters of mercury per second. And we're listening for that first sound, which is our systolic number. Okay, it's 104. And we're listening for that last sound. And it was 78. So the blood pressure is 104 over 78. Then once you have your reading, make sure you fully deflate the cuff full of air, and you're going to take the cuff off of your patient, of course, and clean it if it's not disposable, and you will document the blood pressure and what arm you took it in. Now, what are normal blood pressure readings? According to the American College of Cardiology 2017 updated guidelines, a normal blood pressure is a systolic less than 120 and a diastolic less than 80. Elevated blood pressure would be considered a systolic of 120 to 129 and a diastolic less than 80. Hypertension stage 1 would be a systolic of 130 to 139 or a diastolic 80 to 89, and hypertension stage 2 would be a systolic greater than 140 and a diastolic greater than 90. Okay, so that wraps up this demonstration on how to check vital signs. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and today I'm going to go over with you how to take a blood pressure manually. In the hospital settings, we are blessed because we have automatic blood pressure monitors that take our blood pressures constantly for our patients. But there are times in the settings where we'll have to take them manually, especially if we don't trust the monitor, or sometimes the monitor won't read a patient's blood pressure because their blood pressure is too low. So you have to know how to take a blood pressure manually. So in this video, I'm going to go over how to take a blood pressure manually. I'm actually going to perform the skill, and you'll get to watch me do it and see how I do it. And I want to give you some quick tips that I've just learned over the years with taking blood pressures manually. So first, let's go over equipment. Okay, this is a manual blood pressure cuff. You can get these anywhere, Walmart, off the internet, anything. Typically, it comes with a cuff, It comes, and make sure, because sometimes people buy these and they don't come with the sphygmomanometer, and always make sure that whenever you're buying it, it says with the sphygmomanometer, because sometimes you'll just get the cuff and the rubber bulb, but you won't get that, and you'd have to buy that extra. And this is the big thing of it. So make sure that it comes with this. And you have your rubber bulb that blows up with an open and close valve. And a lot of times they come with little neat carrying bags. So if you're a home health nurse, you have to travel a lot, or you're just wanting to take your own blood pressure, it's real neat to have your own cuff. Also, you need a stethoscope. Many times, if you're just learning to take your own blood pressure, that's why you're watching this video, this cup actually came with a stethoscope, but I like my own stethoscope, but a lot of times they come with a stethoscope. So you'll need your cuff, your sphygmomanometer, and a stethoscope. So let's go over exactly the steps of how to take a blood pressure, and then we will talk, then you'll actually see me perform this skill. Okay, whenever you're taking a blood pressure in the clinical setting, anywhere, you want to have the patient sit down. Have them be calm for about 3 to 5 minutes. If they're anxious, they're real nervous, or they're crying or something like that, have them sit still for 3 to 5 minutes, sitting in a chair with their legs uncrossed and their arm at heart level. Then what you will do, you'll get your cuff, and you need to make sure that you have the right sized cuff. If you have too large of a cuff or too small of a cuff, you will get an inaccurate reading, which is not good. So whenever you put your cuff on the patient, take a look at the patient's arm. You can tell if the patient is really little in this area, you probably need a smaller adult, or if they have a larger arm, you might need a large cuff. How you tell is that you put the cuff on the arm, which I'll show you with my patient that we'll be doing here in a second, and you stick 2 fingers underneath the cuff, and if they fit just right, you have the right size cuff. If not, if it's too tight, too loose, you need to get another size cuff. Next, you're going to ask your patient what arm you can take their blood pressure in. Some people have preferences, and make sure the patient has not had an AV shunt placed in their arm, or they have an IV in their arm, or a PICC line, they've had a mastectomy or history of blood clots, anything. Never want to take a blood pressure in that type of arm. So put your cuff on the patient. You're going to feel for the brachial artery, and I want you to practice this with me. Your brachial artery is found on your elbow, and it's the distal part closest to your body. And the best thing is to extend your arm out as much as you can and feel that bounding. And I can feel mine right now, and that is your brachial artery. That is the artery that we're going to be feeling and listening for. So you'll put your cuff on the patient, and on your cuff you will notice these little arrows, and you'll have an arrow down that'll say left arm, and you have an arrow down that says right arm. So if you're using the left arm, you're going to make sure that that arrow is literally right on or slightly above that brachial artery. So you'll put that on there, and then you'll take your stethoscope, and your stethoscope has 2 sides to it. It has a diaphragm and a bell. Studies have shown that it's really personal preference on what side you want to listen to. I like to listen with my diaphragm. So you're going to take your stethoscope, put it in your ears, and you're going to take this diaphragm and you're going to put it over that brachial artery. Then you are going, and when you hear it, you're going to inflate the cuff with the rubber bulb. And typically you inflate until you cannot hear the brachial artery anymore. This is generally on your little sphygmomanometer. You will inflate all the way up to 180 to 200 millimeters of mercury. 180 is usually sufficient enough. Another how you can know how much to inflate is to ask the patient what their top number, which is their systolic, normally runs. If they say it runs 100, you would inflate to 130 to 140 millimeters of mercury. So the rule is usually to inflate 30 to 40 millimeters of mercury more than what they say that their blood pressure is. But I like to stick with the 180. So you inflate there. Once you inflate, you take your rubber valve and you start letting out air slowly, very slowly. If you do it too fast, you'll get an inaccurate reading. You do it slow where you're seeing that needle drop down 2 to 3 millimeters of mercury. And let me show you what I'm talking about. Behind me I've drawn, it's not the best drawing, but I've drawn a little sphygmomanometer that you would see, and your needle typically starts right here at the end, and as you inflate it goes up. So you would already inflate to the 180 mark. Then when you're letting out the air to 100, 2 to 3 millimeters of mercury, you're going to do it slowly. So it'll do something like this. You'll see this little needle and it'll just start going slowly. And then all of a sudden you'll hear boof. Okay, so we'll pretend we heard the boof at the 120 mark. So our systolic is 120. Then you'll keep hearing the noise. You'll keep hearing boo-boof, 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 boo-boof. And then all of a sudden it'll stop. And you make note where it stopped at. And we'll say it stopped right here, which is the 70 mark. And that is our diastolic. So the patient's blood pressure is 120/70. Then after you get that, what you're going to do is you're going to open the valve all the way, let all that air come out, and tell the patient what their blood pressure is. Always tell the patient what their blood pressure is. A lot of patients want to know, and some people may not ask you because they feel like it might be rude to ask. So just let them know and explain what that reading means. A lot of people is like, well, is that high or is that low? And explain to them what that is. A normal blood pressure reading is usually 120/80. But we're not all perfect, and we all can't have that great blood pressure. Typically, the golden rule, you want that top number to be at least 100. And if the top, which is on the little bit of the lower side, but if that top number starts going in the 150s, 160s, 180s high, that's not good. That's hypertension, and you'll need to let the doctor know. Now, that's how you take a blood pressure. So let's go over some quick tips, and then we'll do our skill. You want to use that correct size. Remember the 2-finger rule. Fit it underneath the cuff. Make sure it doesn't fit too snug, too tight, just right. If the patient has smoked, so always ask them if they've smoked, if they ate, or if they just got done exercising. It's best to wait about 30 minutes before you take that blood pressure because you can get an inaccurate reading. And again, no blood pressures in patients who've had AV shunts, mastectomies, blood clots, anything like that. So now let's do our skill of recording or getting a blood pressure. Here we have our patient. It is my awesome husband, Ben, and he is here to be my test dummy for doing our blood pressures. So the very first thing you want to do is you want to have your patient sit down. And if they've been running around or really anxious or talking, you want them to be calm for at least 3 to 5 minutes before you take their blood pressure because you want to get the most accurate response. Then you will have them have their legs uncrossed and have their arms down by their side. And you want to ask them what arm you can take their blood pressure in, because a lot of patients have preferences on what arm you can use, especially if they've had an AV shunt or a blood clot in the arm or a mastectomy. You would never want to take a blood pressure in that arm. So I'm going to use Ben's left arm. You want to get your manual blood pressure cuff and your stethoscope, and what we're going to do is we're going to put on our left arm, and on your blood pressure cuff you have little arrows that say left and right. These arrows are meant to go over the brachial artery. So we're going to slide our cuff up through the brachial artery, and I'm going to just feel on his brachial artery where his artery is. And it's always on the inside of the elbow, and always have them bend that arm up really good because it pushes the pulse up, and he has a really nice one right there. So what I want to do is I'm going to take where it says that left arm arrow, and I'm going to put it right about 2 inches above that artery. That's where you want the cuff to rest, above the elbow, about 1.5 to 2 inches. And you always want to make sure that your cuff fits the patient. You have really small patients, and then you have some obese patients who would need larger or smaller cuffs. And to check your cuff size, use 2 of your fingers and just slide it underneath the cuff. Make sure it fits good, not too snug, not too loose. Because if you have a blood pressure cuff that does not fit, you will get an inaccurate reading. And this cuff fits him great. So we have that. Now what we're going to do is we're going to get our sphygmometer, and we're going to just clip it here. You can do whatever you want with it as long as you can see it, because this is going to tell us everything that we need to know for his blood pressure. Now what I'm going to do with my stethoscope is I'm just going to listen at that artery. And a lot of people, it really doesn't matter. You can listen with the diaphragm or the bell of your stethoscope. Studies have shown it does not matter. I like to use my diaphragm. So I'm going to place it over his brachial artery. Let me feel it again. Feel it right there. And now I'm going to close the valve on the blood pressure cuff and I'm going to pump it up. You pump it up at least 30 to 40 millimeters of mercury of what they say that their blood pressure is. A lot of patients don't know what their blood pressure normally runs. So it's always safe to say to blow the cuff up to 180 to 200 millimeters of mercury. That's usually sufficient enough in a patient. So what we're going to do is we're going to inflate our cuff to that amount, or until we do not hear the brachial artery anymore. Like I said, we're going to inflate to about 180 millimeters of mercury. Then we're there, and I'm going to slowly release, open my valve, where it goes down at least 2 to 3 millimeters of mercury, just slowly. And what I'm doing is I'm listening for that first beat. That first beat will be our top number, which will be our systolic. And I'll tell you when I've heard it. We're passing 130, passing 120. And I just heard it just now at the 110 mark. I'm still hearing it. Still hearing it. And notice how it's ticking. See it little moving up and down. Okay, and then it has stopped. It stopped at 62. So 110 over 62 is his blood pressure, and I've slowly let the air out. His blood pressure was 110 over 62. And always tell the patient what their blood pressure is, because a lot of people like to know. I know I've been in hospital settings and no one's told me what my blood pressure was, and I would have loved to know. And then of course, take the cuff off of them. And if you have to repeat the blood pressure, you can do it in about 5 minutes. And it's good to switch arms. So thank you so much, Ben, for being my test dummy. And that's how you take a blood pressure. Okay, I hope I helped you learn how to take a blood pressure manually. Thank you so much for watching, and be sure to check out my other nursing clinical skill videos. We have a lot of those, and also teaching series. And be sure to visit my website, registerednursern.com, for all your nursing student needs. And be sure to subscribe to this channel. Thank you so much for watching.
Hey everyone, it's Sarah with registerednursern.com, and in this video I'm going to give you some tips on how to count a respiratory rate. So counting a respiratory rate seems like a pretty simple skill, but it can be tricky, especially if you're first starting out and you're trying to collect all those other vital signs on top of your respiratory rate. Plus, some patients it's easy to count their respiratory rate, while in others it's not. First, let's quickly review how to count a respiratory rate. So a normal respiratory rate in an adult is about 12 to 20 breaths per minute. But not only are we counting that rate, we're looking to see if the breathing is labored or unlabored. And an example of labored breathing would be like this. And notice how the patient's chest, we can really see it moving up and down. They're using their mouth to breathe in and breathe out. Also, we're looking at if the breathing is irregular or regular. So irregular breathing would be patients taking a breath here and there. It's not on this consistent rate. They may like take a breath in and out, and then there's a pause, and then they'll breathe again here and there. A regular rate would be there's a consistent rhythm to that breathing. Now, if the rate is regular, you'll want to count for 30 seconds and multiply by 2. However, if the rate is irregular, you'll want to count for 1 complete minute. So when you go to count the respiratory rate, you want to make sure that you are doing it manually rather than going by the number that's on the monitor. Because as a nurse, I have found that that number that monitor gives you is usually not the rate that your patient is breathing. So always double check that. Now, whenever you do go to count the respiratory rate, you want to make sure that the patient isn't really aware at that time that you're counting the respiratory rate, because they will alter the way that they're breathing. It's just like if I told you I'm going to count how many times you blink. You are going to alter how much you are blinking. You will change it. So whenever you do this skill, you want to combine it with checking the pulse rate. So you'll feel on the side, the radial side, the pulse rate, count that like you normally would. But then you're going to keep your finger on that side and count the respiratory rate. But the patient thinks that you're counting their pulse rate still. And what you're looking for is the rise and the fall of the chest. 1 rise and 1 fall of the chest equals 1 breath. But this is where the tricky part comes into play, because it's like, how do I determine what's a rise and what's a fall of the chest so I can count 1 breath? And here are some tips to help you do that. Now with these tips, you're going to find in practice that some of these tips work great on some patients, while others you may have to change it up a bit because every patient is built differently. They're going to be wearing different clothes, like some patients are going to wear a gown, some may not even have a gown on, and some may be wearing their regular street clothes. And a lot of patients, they have different disease processes going on. So one thing I like to do, if I know this patient, it's going to be hard to count their respiratory rate, I'm going to get down at the level of their chest, like their shoulder and chest area, and their abdominal level. Because I'm looking at that rise and that fall of that chest. I'm getting down here, looking at that while I'm checking that pulse rate. So I start out in that position. And some patients, it's really easy to tell depending on how they breathe. Like the shoulder area will move up and down. The chest area will move back and forth, or the abdominal area will go up and down. Now, if your patient has like a severe disease process where their respiratory system's being affected, like with congestive heart failure, a lot of fluid volume overload, they have trouble breathing, so they're going to use these abdominal muscles to help pull in and out that air. You can actually just see the abdomen going in and out. So that's really helpful whenever you're trying to figure out the rate. Another tip you could do, but I would use this with discretion, depending on your patient and how they are, would be whenever you go to feel that pulse rate, you can lightly put your hand on their back, on their chest, or whatever, so you can feel the rise and the fall of the chest. But with some patients, like if they're agitated, confused, or they're just someone who really doesn't want you in their personal space, you wouldn't want to use this, but with some patients you can. And my last tip would be to group it with your physical assessment. So whenever you're going to assess the chest, you're going to listen to heart sounds and lung sounds. What you want to do is tell the patient, I'm going to listen to your heart sounds for 1 full minute. So while you're there listening to both heart sounds and then lung sounds, they're not going to think that something's wrong. So you're going to take your stethoscope, and first you can listen to their breath sounds and count that rate. It's best to try to pick an area that you want to count that rate where there's not a lot of adipose tissue, because that can really muffle those breath sounds. So generally at that second to fourth intercostal space anteriorly, about mid-clavicular, that could be a great place to count those breath sounds. But again, it really depends on how your patient is built. Then after you count that rate, then you can proceed and listen to their heart sounds. Okay, so that wraps up this video on some tips for counting the respiratory rate. And be sure to check out my other videos, such as a head-to-toe assessment, how to assess heart and lung sounds, along with audio clips of abnormal lung sounds. Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to show you 6 different ways on how to check a temperature. First, let's talk about what is a normal body temperature. In the adult, it can vary anywhere between 97 degrees to 99 degrees Fahrenheit, with the average about 98.6. In a child, it can also vary anywhere between 97.4 to around 100 degrees Fahrenheit. And anything greater than 100.4 is considered a fever in both the adult and child. The first way we're going to check a temperature is through the mouth, so orally. And you can do this one of 2 ways. You can use a digital thermometer, which is most commonly used, or you can use a glass thermometer, which really isn't used as much because they can break. So let me show you first how to use this glass thermometer. Before taking an oral temperature, you want to make sure that the person hasn't consumed anything. And if they have, wait about 15 minutes before taking the temperature. So what you want to do is you want to perform hand hygiene and don gloves. Anytime you're taking an oral temperature, you may be encountering oral secretions, so you want to prevent yourself from getting contaminated. Then you want to make sure your thermometer is clean. So clean it with alcohol prep and let it dry. Now with glass thermometers, you have to pay attention to where the liquid is on the reading scale. If it is above 98.6 degrees Fahrenheit, you will have to take your wrist and flick the thermometer down for that fluid to go below 98.6 degrees. Once the fluid in the thermometer is below that point, you'll want to insert the thermometer in a probe cover just to protect the thermometer from being contaminated anymore. And then take the thermometer and insert it in the patient's mouth. Have the patient lift up their tongue and put it underneath the tongue. Okay, keep it close. And wait for 3 minutes and then remove the thermometer. Once the time's up, you'll take the thermometer out of the patient's mouth and read the thermometer. Then what you'll want to do is remove the probe cover, clean your thermometer with alcohol prep or whatever your facility wants you to clean it with, doff your gloves, perform hand hygiene, and document the temperature, especially the route. Now let me show you how to check an oral temperature using a digital thermometer. Of course, what you want to do first is perform hand hygiene and don gloves. And make sure you're working with a clean thermometer, so always clean it with alcohol prep. Then you're going to take the thermometer and insert it in its probe cover. Then turn the thermometer on by hitting the button on the thermometer and insert it in the patient's mouth. Have the patient lift up the tongue and then put it over and then keep the mouth closed. And then once the thermometer is done, it will beep. Once the thermometer beeps, take the thermometer out of the patient's mouth and read it. Then when you're done taking the temperature, be sure to remove the probe cover, clean the thermometer per your facility's protocol with alcohol prep, and doff your gloves, perform hand hygiene, and document the temperature. Another way you can take a temperature is through the ear via the tympanic membrane. So first, what you want to do, of course, is perform hand hygiene, get your thermometer, and with these type of thermometers, you want to use a probe filter. So place that just over the thermometer, turn your thermometer on, and you're going to insert this in the ear. For the adult, what you'll want to do is you want to take the pinna of the ear, pull it up and back. If your patient was less than 12 months of age, you would want to take the pinna and pull it down and back. So we're going to pull it up and back. We're going to insert the thermometer in the ear. Then we're going to hit the button to take the temperature. Just takes a second. Then we will read our thermometer and it will display the temperature right here. Then after reading the temperature, what you want to do is take the probe filter off and perform hand hygiene and clean your thermometer per your facility's protocol and document the temperature. A third way to take a temperature is through the armpit, the axilla. So to do that, what you want to do is get a digital thermometer, perform hand hygiene, make sure your thermometer is clean, and insert it into a probe cover. Then turn the thermometer on and lift up the person's arm. Place the tip of the thermometer directly into the armpit, not on the clothing. Have them close the armpit and hold the thermometer there until it beeps. Once the thermometer beeps, take it out and read it. After reading the thermometer reading, take the probe cover off, clean the thermometer, perform hand hygiene, and document. Another way to take a temperature is through the temporal artery. So to do that, of course, we want to perform hand hygiene, get our thermometer, and with this specific thermometer, it has a cap cover, so take it off. It does not have the little filters that go over it. Some models do. The manufacturer just recommends cleaning the thermometer. So make sure your thermometer is clean with alcohol prep or whatever your facility requires you to do. What we're going to do is we're going to hold in this button, keep it held. We're going to go to the middle of the forehead and swipe the thermometer across the forehead to the hairline and then release the button and read our temperature. Now, let's say that the patient was sweating, had a lot of sweat on their forehead. How we'd want to do that is, again, hold the button in, go to the middle of the forehead, sweep across to the hairline, and then go behind the ear and read our thermometer. Then clean your thermometer, recap it with the protective cover, perform hand hygiene, and document. Another way to check a temperature is rectally. So to do that, you want to perform hand hygiene and don gloves when checking a temperature this way. You want to get a thermometer and you want to make sure it's clean. Then insert the thermometer into a probe cover and then lubricate the tip of the thermometer. Then turn the thermometer on and have your patient positioned on their back with their knees bent. Then insert the thermometer into the rectum about 1 inch. Then remove the thermometer once it beeps and read the temperature measurement. After reading the temperature, take the probe cover off, clean the thermometer, doff your gloves, perform hand hygiene, and document. Another way to take a temperature is through the skin using a temperature strip. And to do that, you want to perform hand hygiene, peel off your strip, and put it on the forehead. And after placing the strip, within 15 seconds, a dot will start to appear, and whatever turns green will be the temperature reading. Then once you have read the temperature, just take the strip off and dispose of it. Then perform hand hygiene and document. Now you may be asking yourself, which route is the most accurate? According to the experts, the rectum is the most accurate route to take a temperature. The least accurate route would be the skin or the armpit. So always use that as last resort. And whenever you take a temperature in the rectum, it's always going to read about a degree higher than the mouth. And if you take a temperature in the armpit, it's going to read about a degree less than the mouth. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.